No, Sandra, this is such a peaceful part of Streatham, and it's not far from Ambleside Avenue, where Cynthia Payne lived. Yeah, I know, though I don't think the locals appreciate the historical significance. They are always campaigning for the vice squad to be reinstated. I like it here. The work is so plentiful, and the income is not inconsiderable. Hey, quit yakking. We need to get to Garrades Road and offer adult services. Meet you back here in the early hours? We can walk back together. That sounds like a plan. Hey, have you seen HT recently? HT? Oh, he is such a nice man. I mean, I know he has been in and out of Brixton, but he always supplies the best quality crack. We need to get more heroin from JB. We should get him to bring it to the house when he next comes for his routine visit. Hey Jane, where are we meeting? I am not far from Balham. She must be working. That's Jane's shoe in that garden. Jane, where are you? Jane, can you hear me? Where are you? Are you okay? Can you talk? I can't get up. He didn't pay. He didn't pay. You're bleeding. I am calling an ambulance. Hello. Hello. Please help. I need an ambulance. My friend is on the floor. No, in the street. Yes. I don't know what to do. We're in Balham near Ravenstone Junction. Sorry, I can't hear you. What do I need to check?
Can you hear me? What is your name?
Jane.
Jane, do you know where you are?
In Balham somewhere.
How old are you, Jane?
25.
Are you hurting anywhere?
No. I just want to go somewhere warm.
Do you have any pain in your back or neck?
No.
Any pins and needles anywhere?
No.
Let me look at your arms. Your friend says that you have cuts. Okay. You have some minor cuts. I don't think that you have any serious injuries. But I think we should take you to hospital just to be on the safe side. Can you tell us what happened to you?
He stopped his car and asked me. I don't know what he asked me. But he got out and I don't know. He grabbed hold of me.
Are you on any medication, Jane?
No.
Do you have any allergies?
No.
Have you ever been to hospital before?
I think so.
Do you know what it was for?
No, and I can't remember when.
When was the last time you had something to eat?
I'm not hungry.
Okay, well, she is conscious and complaining of minor injuries. She has some scarring on her arms and legs and she is struggling to walk. I think we should admit her to the clinical decision unit for observation. I'll have a look at her records. Jane Simpson, date of birth the 12th of December 1986. No fixed address. Her GP is Dr. Ward at Knocking Shop Surgery. She has been using crack cocaine for 5 years, and intravenous heroin for 8 years. The patient was seen in Rowan Ward for a detox 9 months ago. She discharged herself and could not be followed up. Virological test results show no hepatitis B, but hepatitis C antibodies and genes were detected. Jane, do you remember coming to St. George's before? Jane, you had some blood tests carried out in March. You were in Rowan Ward. I understand that you left the ward and we couldn't contact you. We sent a letter to your GP. Has he spoken to you?
Yeah, maybe.
Jane, the test results showed that you were infected with a virus. It is called hepatitis C virus. We need to take another blood sample from you and repeat the test, and carry out a few more virology tests. We also need to check your liver function.
I've been using drugs for years. I don't know, 10 years? It has got worse. I have to work every night just to pay for it.
We are going to keep you in for a few days until all the tests are completed.
Went to see the GP weeks ago. I wanted to try and come off the drugs. He sent for the hepatitis tests again. He said it was bad, and the hospital doctor had told him that he had to do other tests.
I will contact your GP and find out what tests have been carried out. Then we can talk about other tests that need to be done. The tests showed hepatitis C antibody and genes were detected. Her ALT was elevated, but everything else was within normal limits. I better explain this to her. Jane, you are infected with hepatitis C virus, and the infection is not clearing. The virus is replicating inside your blood. The virus can damage the liver, so it is important that you do not drink alcohol, as this can make things worse. Patients who have hepatitis C are at a high risk of developing cirrhosis. I recommend that you have some further tests, including a fiber scan, to determine if you need immediate treatment. You will be treated with ribavirin and pegylated interferon. The interferon will make you feel like you have the flu. But you must continue the treatment for 3 to 12 months for it to have any effect. The ribavirin is taken orally, but the interferon is an injection that you have to take once a week. In a lot of cases, the treatment is successful, and the virus is cleared. Sometimes, if it doesn't clear, we need to take a biopsy from your liver to see how much damage has been done. But we won't do that at present. Jane has discharged herself from the hospital. Her GP is unable to establish contact,